The Preventive Services Program, also known as PSP, is designed to mobilize a community toward protecting the oral health of its children. People across Missouri are gathering together for PSP events to make a difference where they live. Unlike most school-based programs, PSP is not dependent upon free and reduced lunches, but rather it is available to every child in every school district in the state of Missouri, along with their parents' consent.
Bonnie, can you tell us exactly what the Preventive Services Program is?
The Preventive Services Program is kind of like an oral health program in a box that's offered to a community. The program has a variety of components that are given over that you can put together in the best way that it would serve your community. As you see on the slide, we say that this is a community-based systems approach to population-based prevention of oral disease. We offer this to a community so that the community can embrace the oral health needs of their children.
And what is involved in a PSP event?
A PSP, or Preventive Services event, has 4 components. The first is surveillance. Once a year, a licensed dental professional, either a dentist or a dental hygienist, will come into the school or the Head Start or the community area in which this will be implemented and screen the children. The second is an educational component. We leave this up to the community as well. We hope that the community will utilize some method of educating the children as they are involved in PSP. The Department of Health offers a variety of curriculum materials that can be implemented, or the community can choose some of their own materials from elsewhere. The Department of Health does provide brushes, toothpaste, and floss for all the children that participate in PSP. The third piece of the methodology for PSP is what's known as intervention, or a method of preventing future dental problems. And the method that has been chosen by the Department of Health is an application of fluoride varnish. PSP allows for 2 fluoride varnish applications per year, and this fluoride is given over to the community free of charge and applied by volunteers. The last segment of a PSP is the segment known as referral. We hope that every child who is identified with urgent care needs is given an opportunity to be moved to a dental home where there can be some care given to intervene in the pain that they may be experiencing.
And do you think that without this program, some of these kids would get the dental care that they need?
Not particularly. Sometimes a parent is not aware of the dental needs in a child's mouth, and because of the screening, those needs are brought to light, and also then the community can become involved in how to get a child to a dental home. Sometimes a parent's not aware of areas that they can go to seek dental care, and by us helping that school nurse or event coordinator find places where a child can be taken, then those places are already identified and the parent can move forward in getting some care when it's urgently needed.
And who are the individuals involved in a PSP event?
As you can see from the screen, the event is composed of people from the community. Although the Department of Health does provide materials and consultation and help in getting started, the events are coordinated and operated by community volunteers. An event coordinator could be anyone. It could be a school nurse, it could be a health department nurse, it could be an interested parent or teacher. The screeners then are the dental professionals from the communities. We need either a dentist or a dental hygienist to collect the information, primarily because this data is used statewide and nationally to take a look at our children across the state. So we need that license component to be sure that the person collecting the data has some education behind them in the field of dentistry. The varnish volunteers are people that apply the varnish twice per year. This could be, again, an interested parent, a school nurse, a teacher, Some of the grandparents that come into the area that do Loving Helping Grandparents programs are great varnish volunteers. And then there's always room for other helpers to direct children, to help educate children, to move them from one place to another, or just to maybe perhaps help keep records. It takes many hands, but a community involved in this way does embrace the needs of the children.
And how do the places where the PSP events are going to be held, how do they recruit the volunteers?
Well, there are a variety of ways. Many engage their parent-teacher associations in taking this on as a project. Some simply know the parents in the school district that are willing to help and give them a call. Others have asked some of the local civic organizations to help on an event.
And can you talk about the roles and responsibilities of the groups involved?
Sure. The Department of Health and Senior Services, the oral health program through them, offers the consultations of the oral health consultant. We offer a media campaign to keep a community involved. We have educational materials that are available for the school districts to use or Head Starts to use if they choose to. We have the screening supplies, which include a disposable mirror and toothbrushes, toothpaste, and floss available for the children. We do provide enough supplies so that the children can have 2 fluoride varnish applications through a year. We do training, we do support in whatever way we can to make sure the community is able to move this program forward. Sometimes our consultants will come out and talk to a school district, a parent-teacher association, a city council, a Lions Club, a group of school nurses, but we're there to help you get it started. The community is the doers of the program. We need the community to have someone there who will be a contact, a point of contact for us as oral health consultants. We need the community to take on the responsibility of scheduling volunteers, getting folks set up on a day, locating a place to have this occur. We also ask that the community assist in some kind of a referral system development. This may be very formal or it may be very informal. It's just a method of finding a place to have a child seen if urgent needs are identified.
And why should a community consider a PSP event?
Well, just looking at this slide, you can see the great need that we have in Missouri of our children. Having done many screenings, I can tell you that it doesn't matter what schools I've gone to, whether it be an early Head Start or a high school group, there's always a handful of children, usually between 5 and 8% of our children, that have urgent dental needs in their mouths. And this means, by urgent, we mean that a child's in pain, they're unable to eat or play or sleep or go to school. And whether it be the most affluent school district or the more needy of our school districts, there's always that 5 to 8% of our kids that need some urgent care. We want to help find those kids. We want to help get them moved into care. But more important, we want to address the dental problems on the other end of the continuum. We want to find problems, and not just find problems, but we want to try to help prevent problems before they begin. Fluoride is a major public health achievement. Dental decay is actually on the rise in children between the ages of 2 and 5 years old. And the advent of this fluoride varnish intervention is excellent for children between those ages of 2 and 5, but it also works well in older age groups.
Do children who have fluoridation in their water systems, do they also need the fluoride treatment?
Excellent question, Amy. Yes, they do. The fluoride varnish treatment is similar to a topical fluoride treatment that you would receive twice per year at your dental office. And in high-risk groups, recommendations even ask that the fluoride varnish be put on every 3 months as opposed to every 6 months. So a twice per year application is just adding that much more to what water fluoridation already does. Well, fluoride varnishes are effective in preventing tooth decay in both the primary and the permanent teeth. It's been proven that fluoride varnish can reverse early decay and even arrest some active dental lesions. We know that fluoride varnish remineralizes tooth enamel, making it resistant to tooth decay. Now, this doesn't mean that fluoride varnish cures tooth decay. It just means that as a tooth softens and begins that early decay process, that the varnish will help strengthen the tooth and restore it back to a healthier state so it's not likely to decay on through the enamel. Fluoride varnish sets up on contact with moisture from the saliva. Therefore, the child is not likely to ingest the fluoride, and of course, because it's easily set on the teeth, it works well for infants through older adults, in fact. The fluoride varnish, after a period of several hours, can be brushed away. In the program, we ask that you leave the fluoride on for a full night and brush the next morning. Fluoride varnish is cost-effective, and it's a wonderful preventive measure against tooth decay. We feel like fluoride varnish is safe because we have some of the strongest, most notable associations behind the program. We have the American Dental Association, the Association for State and Territorial Dental Directors, and the Centers for Disease Control that all promote the use of fluoride varnish as being effective in preventing tooth decay. Now, these screenings that are included in a preventive services program are not a complete dental exam. Of course, no radiographs or x-rays are made, and we know that the screening is a quick look into a mouth. A thorough dental diagnosis or treatment plan is not developed from this screening. But the screening does identify obvious oral lesions, and it does initiate a referral for the child when there's dental need and a chance to intervene before the need becomes too dramatic.
And did you say earlier that if there is a need for further treatment, that your program helps them find a dentist or someone that they can go to?
We do our best in that. As we all know, in Missouri, there are some areas of the state that are underserved for dental care. We do maintain a list and try to keep our contacts wide open with dentists and dental providers that can assist the children in certain areas, in all areas. So when we go into a community, we make sure that the community knows what is available to them for dental care for their children. Fluoride varnish is applied in a very easy manner. The process usually only takes a minute or two. Basically, the varnish is painted on all the surfaces of the teeth with a disposable applicator, and it will go on a little bit thick looking. It'll have a fuzzy feel to the child, but that fuzzy feeling goes away and the varnish is brushed off very easily the next day. This slide addresses the supplies that are provided by the Department of Health and Senior Services. As you can see, we provide the screening forms, disposable mouth mirrors, fluoride varnish, toothbrushes, toothpaste, floss, educational materials, and other promotional items. All of these are ordered through the oral health consultant. That's why it's very important that you work directly with the dental hygienist that's assigned to your area to get this program up and running.
And none of these costs are ever put on the parents or the students, anything like that?
Exactly. The materials, the supplies, the consultation, all of this is done free of charge and provided through the Department of Health and Senior Services. There are a few supplies, though, that it would be good if the event coordinator had on hand. These are supplies like gloves, masks, some hand sanitizers. We ask the local groups to supply these because the people using these gloves and masks all have individual sizes and preferences. So we ask that those are provided locally. Space for a preventive services program event is very minimal. It's nice to have a quiet area so that children have a little bit of privacy when the fluoride varnish is being applied or the screening is being done. But a library, a corner of a school cafeteria, sometimes a reading room or art room, all work very well for this PSP event. In our Head Starts, our early Head Starts, just a quiet corner will work very well. Doesn't require much space. The one requirement is that there be good lighting and perhaps some chairs and a small table at which the children can sit and the supplies can be laid. Paperwork. There's always paperwork with every program. Screening forms are used to collect the information, and it's helpful if there's an assistant there to do the paperwork while the screener is identifying the findings. Once this paperwork is completed and the screening form's done, the forms are simply put back into a self-paid envelope and sent right back to DHSS. DHSS adds the information. Of course, every child is anonymous. There are no names on these papers. The information is entered into a database, and then the annual reports of the oral health of the children in that community or that school can be reported back to the event coordinators so that that group will know how they're progressing over the years with their oral health of their children. We've had a lot of success throughout Missouri in the last year and a half. During the 2007-2008 school year, 17,655 children were screened and provided with oral health education, fluoride varnish applications, and referral for dental care. We've been in existence now for almost 2 years, and that's quite a great start. We look forward to increasing these numbers each year with PSP activities. This is always our goal, the end result. Happy and healthy children, happy and healthy smiles. If you need more detailed information on the Preventive Services Program and to find an oral health consultant nearest you, visit the website. That's www.mohealthysmiles.com.